PSC Nursing പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പർ ഡിപ്പാർട്ട്മെൻറ്റ് ഓഫ് ഹെൽത്ത് സർവീസ് 30/7/2010 സ്റ്റാഫ് നഴ്സ് നടത്തിയ എക്സാമിൻ്റെ ക്വസ്റ്റ്യൻ പേപ്പർ ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. 100 ചോദ്യങ്ങളും അവയുടെ ഉത്തരങ്ങളുമാണുള്ളത്. വീഡിയോ ഇഷ്ടപ്പെടുന്നവർ ലൈക്ക് ചെയ്യുകയും അല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യാൻ ശ്രമിക്കുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയതായ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും വീഡിയോയുടെ കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. ചോദ്യത്തിന് 4 ഓപ്ഷൻസ് ആണുള്ളത്. ആ 4 ഓപ്ഷനും വായിക്കത്തക്ക വിധമുള്ള സൗകര്യം ചെയ്തിട്ടുണ്ട്. അതുകൊണ്ട് ഗ്യാപ്പ് ഇട്ടാണ് ഉത്തരം പറയുന്നത്. ഉത്തരം മാത്രമായിരിക്കും, ഓപ്ഷൻ മുഴുവൻ വായിക്കുന്നതല്ല, ഉത്തരം മാത്രമായിരിക്കും വീഡിയോയിൽ പറയുന്നത്. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. Which nursing diagnosis takes highest priority for a child in the early stages of burn recovery? Risk for infection. While caring a client with pulmonary edema to promote oxygenation and relieve dyspnea, immediately the nurse should place the child in high Fowler's position. The immunoglobulin specific for an allergic response. IgE. Tachycardia can result from fear, anger, and pain. Which of these patients is at risk for fluid volume excess? Renal failure. Labor is divided into how many stages? 4 stages. Which of the following statement accurately reflects a risk factor for breast cancer? Mother affected by cancer before 60 years of age. Which of the following categories identifies the focus of community health nursing practice? Promoting and maintaining the health of population and preventing and minimizing the progress of disease. When performing the assessment of a 1-year-old in a well baby clinic, the nurse should expect that the infant will be able to attempt climbing stairs. In which part of the uterine tube fertilization occurs? Answer is ampulla. The client receiving high dosage chlorpromazine hydrochloride has developed tremors of the hands. The nurse should report the symptoms to the physician. After delivery, the mother's vital signs are temperature 99.4 Fahrenheit, pulse 80, regular and strong, respiration 60, slow and even BP 148/92. The assessment the nurse should continue to monitor is the client's blood pressure. The chief clinical manifestation that may be expected in the early stages of cataract formation is dash. Blurred vision. A client with MI is receiving tissue plasminogen activator. Which of the following is a priority nursing intervention? Monitor for bleeding. Group therapy can best help those who feel they have a problem. The most common complaint associated with a disorder involving the inner ear is dash. Tinnitus. The most common area to develop bleeding in a hemophilic child is dash. Joints. The best way for the nurse to assess pain in an 18-month-old child is dash. Observe for behavioral changes. While taking tolbutamide for diabetes mellitus, instruct the client to avoid alcohol. Umbilical cord consists of umbilical cord consists of two arteries and one vein. The most important method of preventing amoebic dysentery is dash. Sewage disposal. Hypertension associated with Addison's disease involves a disturbance in the production of mineralocorticoids. To ensure accuracy when assessing a client's blood pressure, the nurse should avoid parallax error by reading the manometer at eye level. During labor, station +1 indicates that the presenting part is dash. Slightly below the ischial spines. Breastfeeding is contraindicated with the mastitis. The most common cause of diabetic ketoacidosis presence of infection. The birth height doubles by dash years of age. For the smallest bone in the human body is dash stapes. A Foley's catheter operates by the principle of gravity. Following right pneumectomy, a critical nursing intervention when the client regains consciousness would be to place the client on the right side. Anti-infective vitamin is dash. Anti-infective vitamin is dash. Vitamin C. The postcoital test to evaluate fertility is best timed within 1 to 2 days of presumed ovulation. When encouraging the client to void, the most basic method the nurse should employ is dash. Providing privacy. The types of membrane that lines the knee joint is dash. Synovial. While planning care for a client with gout, includes strategies for decreasing purines in the diet, Phrenoderma is due to deficiency of vitamin A. Hypoparathyroidism put the client at risk for which electrolyte imbalance? Hypoparathyroidism put the client at risk for which electrolyte imbalance? Hypocalcemia. Following surgery, a client requires 7 days bed rest, for which complication the nurse should be alert. Venous thrombosis. Diabetes insipidus is due to deficiency of ADH. While giving preoperative teaching to a client posted for herniorrhaphy, the nurse should instruct to splint the incision if he cannot avoid sneezing or coughing. While teaching a client with gouty arthritis receiving endomethacin treatment, which instruction should the nurse include: take the drug with food or milk. For a client with spinal cord injury, the best muscle to give IM injection is dash. Deltoid. In order to reduce discomfort to a client with a hiatus hernia, he should be instructed to sleep with his upper body elevated. Which nursing diagnosis has to be given priority for a patient with end stage renal disease? Excess fluid volume. Which of the following is a bacterial infection? Pertussis. A client with cirrhosis liver develops ascites and requires paracentesis. Relief of which symptom indicates that the procedure was effective? Dyspnea. A client who is on long-term anti-inflammatory agents has dark tarry stools. This indicates bleeding in the upper GI tract. Pulse polio immunization started in the year 1995. A client with right-sided heart failure has a central venous pressure of 12 cm of water. The nurse suspect which of the following? Fluid volume overload. Feco-oral route of transmission is in feco-oral route of transmission is in polio and hepatitis A. The main indication for hemodialysis for a client who has chronic renal failure is hyperkalemia. A client is brought to the emergency room with a Colles fracture. Which bone may be affected? Fracture of distal radius. A disturbed client repeats phrases that others have just said. This type of speech is known as dash. Echolalia. Dietary treatment of children with PKU includes Dietary treatment of children with PKU includes low phenylalanine diet. A viral infection with red blotchy rashes and Koplik spot in the mouth is dash. Rubella. At birth, the infant's intestines are sterile. The bacteria are lacking for the synthesis of prothrombin. In maintaining fluid balance of the body, the major role is performed by kidneys. For a client to utilize the fat-soluble vitamins, the body must produce bile. Neomycin is administered to a client with cirrhosis liver to prevent the formation of ammonia. The major cause of post-transfusion hepatitis is dash. Hepatitis C. The manifestation of cancer cervix that may bring the client to the gynecologist. Bloody spotting after intercourse. The main blood supply to the uterus is directly from the uterine and ovarian arteries. Prominent symptoms of paranoid schizophrenia are delusion and hallucinations. When assessing a client with varicose veins, the nurse should expect complaints of leg fatigue, to control uremia in a client with renal failure. The client should be advised to limit the intake of protein. The most therapeutic position for a client with pelvic inflammatory disease is dash. Fowler's position. After birth in a normal neonate, the ductus arteriosus becomes the ligamentum arteriosum. The primary critical observation for UPCAR scoring is the heart rate. An adolescent is admitted with tetanus. The nursing care should be primarily directed toward decreasing external stimuli. The most advantageous therapy for a preschool child with a history of physical and sexual abuse would be play therapy. In a client who is on lithium treatment, it is necessary to monitor serum levels of lithium. Thanks for watching. PSC Nursing വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ചാനൽ ലൈക്ക് ചെയ്യുകയും ഇഷ്ടമല്ലാത്തവർ ഡിസ്ലൈക്ക് ചെയ്യുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുവാൻ ശ്രമിക്കുക. തുടർന്നും പ്രീവിയസ് ക്വസ്റ്റ്യൻസിൻ്റെ വീഡിയോ അപ്ഡേഷൻ വരുന്നതാണ്. നിങ്ങൾക്കത് സമയത്ത് ലഭിക്കുന്നതിനായി സബ്സ്ക്രിപ്ഷൻ ബട്ടൺ അടുത്തുള്ളതായ ബെൽ ഐക്കൺ ക്ലിക്ക് ചെയ്യുക. അതിനോടൊപ്പം ഓൾ എന്നത് ആക്ടിവേറ്റ് ആക്കി നിർത്തുക. പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.